Have you ever wondered what really happens to your prostate when you masturbate after 70? It's a topic many avoid, but the truth is, your body is still changing, still responding, and how you engage with it matters more than you think. In this video, we're going to explore 6 surprising changes that occur in your prostate. When you masturbate in your 70s and beyond, some of them are helpful, some of them are cautionary, and all of them can help you understand your body better, feel more in control, and make smarter choices for your health. Stay with me until the end, because what you learn here might just give you a new sense of confidence, not just in your prostate, but in how you age. Maintaining prostate health is crucial as men age, and one key aspect is managing fluid buildup. The prostate gland naturally tends to enlarge over time. Regular ejaculation, whether through sexual activity or masturbation, can help reduce the stagnation of prostate fluid. This is particularly important for men over 70, as the gland becomes more susceptible to swelling, tenderness, or benign enlargement. The goal isn't to prevent all prostate issues, but to promote healthy circulation in the area. When fluid remains in the prostate for extended periods without release, it can lead to a sensation of heaviness or pressure in the pelvic region. For some men, this discomfort might even be misidentified as other conditions. However, occasional release aids in clearing out the fluid, akin to flushing a pipe that has held still water for too long. There's a quiet comfort that comes from knowing your body is still responding the way it should. And for many older men, staying sexually active either with a partner or on their own can serve as both a physical and emotional reassurance. Not just that everything still works, but that the body still belongs to them. I remember a man named Leonard 74 who once joked, "If my joints are going to ache, I at least want my plumbing to stay smooth." He wasn't being crude, he was being honest, and for him staying consistent in his routine helped him feel more balanced, less discomfort, fewer nighttime trips to the bathroom, and a stronger sense that his body hadn't given up on him. It's worth noting that while this habit is normal and healthy, it's not a one-size-fits-all solution. If you're dealing with ongoing pelvic pressure, difficulty urinating, or discomfort after climax, it's always worth speaking with a healthcare provider. But for many men, especially those in their 70s and 80s, regular release supports a healthier, less congested prostate, and may even reduce the need for medications or procedures later down the line. Number 2. Strengthen pelvic floor muscles and better urinary control. One of the lesser-known benefits of regular sexual activity after 70, including masturbation, is how it supports the pelvic floor. That group of muscles, often ignored until there's a problem, plays a crucial role in bladder control, prostate function, and even sexual satisfaction. And like any muscle, when it's used with purpose and regularity, it tends to stay stronger for longer. As men get older, the pelvic floor can weaken. That can lead to issues like dribbling after urination, urgency, or even occasional leakage. These are common complaints among older men, but they're not always inevitable. Engaging the muscles during climax helps keep that entire region activated, something like a natural form of exercise that supports both control and confidence. There's also a feedback loop at play. When you feel more control over your urination, you tend to move more freely in public, sleep better at night, and live with less quiet embarrassment. It's not just about physical function, it's about freedom. I remember speaking with Charles, 79, who was hesitant to talk about these things at first, but after dealing with minor leaks that made him avoid long car rides or public outings, he started incorporating simple pelvic floor exercises alongside regular healthy sexual activity. After a few months, he said, "I'm not just managing symptoms anymore. I feel like I'm steering the ship again." It's also worth noting that the muscles involved in climax overlap with those used during urination and bowel movements. When those muscles stay engaged through healthy function, they're more responsive when you need them. That can mean fewer interruptions to your day, better bathroom confidence, and even improved posture and back support for men over 70. Every system is more connected than it once seemed, and regular safe sexual activity can serve as a natural way to keep those connections strong, especially when it helps maintain muscle tone in an area that's easy to forget until it stops working. Well, if you're still watching this video and finding these insights valuable, please comment number 2 below to let me know you're here. And if you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any videos. Your support helps us continue creating good content to inform and inspire you. Now, let's move forward. Number 3. Increased blood flow supports prostate tissue health. As the body ages, circulation naturally becomes less efficient. You might feel that in your hands and feet, but it also affects internal organs, including the prostate. What regular sexual activity does, especially after 70, is encouraged fresh blood flow to the pelvic region. That may sound simple, but its effects are anything but small. When blood moves freely through the area, oxygen and nutrients reach the tissues that need them most. That includes the muscles, the nerves, and the prostate itself. This kind of localized circulation doesn't just support comfort. It helps keep the tissues from becoming stagnant, stiff, or overly sensitive. In a way, it's like watering a plant too little, and things start to wither just enough. And the system stays flexible, nourished, and better equipped to respond to stress. Men who remain sexually active into their 70s and 80s often report fewer sensations of tightness or pressure in the lower abdomen. They also tend to have fewer complaints about that dull ache that sometimes accompanies long periods of sitting. And while the exact medical cause isn't always clear, one theory is that increased blood flow keeps the nerves and tissues in that area more resilient, more capable of bouncing back after strain. I once spoke with Harold, 75, who had a sedentary lifestyle, but made time every week to engage in intimacy with his wife or through self-care. He told me it's not just a release. It's like it wakes everything up down there. I walk different, I feel different, and his words point to something real. The act of arousal and climax creates movement, stimulation, and circulation in an area that otherwise stays still most of the day. This isn't about forcing activity or overdoing it. It's about gently encouraging a system that benefits from regular movement, just as you'd stretch your legs to avoid cramps or take a walk to keep your heart strong. Occasional stimulation of the prostate area, when done safely and respectfully, can act like a tub. It's one more way to support health from the inside out, especially in a stage of life when every small edge makes a difference. Number 4. Potential reduction in long-term prostate cancer risk. One of the more surprising findings in recent prostate research is the link between regular ejaculation and a potentially lower risk of prostate cancer. Several large studies, including one that followed thousands of men over decades, have shown that men who ejaculate more frequently, particularly into their later years, may have a slightly reduced risk of developing prostate cancer compared to those who don't. Now let's be clear, this isn't a guarantee, and it's certainly not a cure, but it's part of a bigger picture. Ejaculation may help flush out potentially harmful substances from the prostate ducts, reducing congestion and cellular buildup that over time could play a role in inflammation or abnormal cell growth. In other words, it helps the system stay clean, responsive, and less prone to lingering stagnation. This doesn't mean frequency alone determines your cancer risk. Genetics, diet, environment, and overall health all play a part. But when researchers isolate patterns in large groups of men, they've consistently found that those with regular, consistent sexual activity tend to show slightly better outcomes in long-term prostate health, including lower rates of cancer diagnosis. I once knew a man named Vince, 82, who said, "I used to think sex was just for pleasure. Now I see it's part of the plumbing too." He wasn't being flippant. He was reflecting on how his mindset had shifted. For him, sexual activity had become not just a form of expression, but a quiet act of maintenance, just like brushing his teeth or going for a walk. It's also important to note that this isn't about pressure or guilt. You don't need to follow a number or meet a quota, but staying connected to your body, staying engaged in healthy function, even modestly, can serve as one small proactive choice in the larger story of your health. And of course, regular checkups. PSA: screenings and open conversations with your healthcare provider remain essential. No amount of activity replaces awareness, but if regular release may support prostate health on multiple levels, then it's worth viewing it as more than just a private moment. It's a potential investment in your long-term well-being. If you're still watching this video and finding these insights valuable, please comment number 4 below to let me know you're here. And if you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any videos. Your support helps us continue creating good content to inform and inspire you. Now let's move forward. Number 5. Temporary irritation or swelling if overdone. While there are clear benefits to staying sexually active after 70, it's just as important to acknowledge the limits, especially when it comes to frequency, technique, and physical sensitivity. The older prostate and surrounding tissues are not as forgiving as they once were. Overstimulating the area too often, too roughly, or without enough recovery time can sometimes lead to mild swelling, irritation, or discomfort. This doesn't mean there's something wrong with your body. It just means your tissues need a little more care and patience. If you notice a dull ache in the perineum, the area between the scrotum and anus, or a feeling of pressure or tightness afterward, it could be a sign that the area has been overworked. This is especially common in men who suddenly increase their activity after a long period of inactivity. There's also something called prostatitis, which refers to inflammation of the prostate. While not always caused by sexual activity, it can be triggered by mechanical irritation. It's usually temporary and manageable, but it's a good reminder that even healthy routines should be done with balance. Rest is part of function, just like with muscles after exercise. I remember Walter, 76, who had recently started dating again after years of being alone. He was thrilled to feel desire again, but after a few weeks of frequent activity, he noticed some soreness and pressure that didn't go away. His doctor explained it was likely temporary inflammation and advised him to take a short break and drink more water within days. The symptoms eased, Walter told me. Turns out, even good things need moderation. This isn't about limiting pleasure, it's about extending it. Listening to your body, giving it space to recover, and adjusting the rhythm as needed allows you to continue enjoying your sexuality without unnecessary setbacks. If irritation becomes common or interferes with urination, it's important to speak with a healthcare provider, just to rule out infection or more serious conditions. Ultimately, the goal isn't just activity, it's sustainable wellness. The kind that lets you enjoy your body, feel connected, and stay comfortable day to day. A thoughtful, gentle approach respects the changes age brings while still celebrating everything that's still alive and working within you. Number 6. Hormonal shifts and changes in prostate sensitivity. One of the quiet changes many men notice after 70 is that climax feels different, not just emotionally, but physically. This isn't a failure, it's a natural shift in how the body responds to stimulation. And a big part of that comes down to hormones, particularly testosterone. After a certain age, testosterone levels decline more noticeably. And that affects everything from desire to sensitivity, even to how the prostate itself responds. Some men find that ejaculation takes longer or feels less intense. Others may feel more tenderness or notice that recovery time, the time it takes to feel ready again, has stretched out. These aren't signs of something wrong. They're signs that the body is working at a new rhythm. And understanding that rhythm can make a big difference in how you care for yourself. What's interesting is that some men report greater emotional satisfaction. Even as physical intensity decreases with age, often comes a deeper awareness of the moment of connection, of what the experience means rather than just what it feels like. And that shift, while subtle, can make sexual activity feel more intimate even when it's with yourself. I once heard from a man named Bruce, 80 years old, who said, "It's different now, but in a good way. I'm not chasing a firecracker, I'm sitting with a slow-burning flame." His words stuck with me. He wasn't mourning the past. He was embracing the present and recognizing that his body still gave him something worth honoring. From a medical perspective, hormonal shifts can also make the prostate slightly more or less sensitive to touch. For some men, that means they have to explore new ways of stimulation to feel satisfied. For others, it may mean going more gently or taking longer to warm up. Either way, patience becomes a virtue and often a key to deeper satisfaction. It's also a good reason to stay in touch with your doctor if you're noticing drastic changes in libido, energy, or mood. A simple hormone panel can help you understand what's happening and whether anything needs support. Sometimes a small adjustment can make a big difference, but in most cases, the shift in sensitivity is not a problem. It's a recalibration, one that invites you to tune in, slow down, and work with your body, not against it. Because even after 70, pleasure is not out of reach. It simply speaks in a softer, more refined language, one that rewards attention, care, and respect. If you're still watching this video and finding these insights valuable, please comment number 6 below to let me know you're here. And if you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any videos. Your support helps us continue creating good content to inform and inspire you. Now, let's move forward. Final thoughts. Now that we've walked through these 6 changes, take a moment to reflect which one surprised you the most. Which one made you feel more connected to your body, instead of less growing? Older changes things, yes, but it doesn't end them. Your body might move differently, respond more slowly, or crave more care than it used to. But that doesn't make it broken, it makes it wise, and understanding what your prostate is going through, what it needs, how it functions, and how it reacts to healthy stimulation can give you something many older men don't even realize. They're missing: clarity, reassurance, and quiet confidence. Sexual activity after 70, whether alone or with a partner, isn't about proving anything. It's about staying present in your body. It's about circulation, comfort, control, and above all, connection to your health, to your identity, and to the part of you that still wants to feel not just useful, but alive. If there's one message I hope you take from this video, it's this: you are still allowed to care for yourself. In this way, you are still allowed to feel pleasure, to honor your body, and to take pride in understanding how things work. There is nothing shameful about that. In fact, it's one of the most human things you can do. So whether you're just learning about these changes for the first time, or this video confirmed what you've quietly suspected for years, I want to remind you, you're not alone, and more importantly, you're not finished. There is still so much of you that's strong, curious, capable, and worthy of good care. Thank you for joining us today. We'd love to hear from you. Leave a comment below and share one thing you learned today and how you plan to use it in your life. Your thoughts are important to us, so don't hesitate to share them. Reading your comments gives us great motivation and encouragement. If you enjoyed this video and found it helpful, please like, subscribe, and share your support. Helps us continue creating good content to inform and inspire you. Thanks for watching, and we look forward to seeing you in the next video.